Hi, welcome to Wellness Woodbridge. I'm your host, Ann Mazza from Vito Mazza Salon and Spa and Hair and Scalp Wellness. I'm very excited about our show today. It is a personal testimonial that I'm very passionate about my guests. They're both very good friends now that I've gotten to know them, one of them being our employee, Martita Squires, and another one, Dr. Asha Iyer. So these women met each other through an experience in neuroscience, and we're very excited for our guests at home to get to know what happened with this amazing relationship that they have formed. So I'm going to start with Martita. I'd like to welcome you both.
Yeah.
Okay.
Very excited to have you here, and we're thankful for you to tell your story because many people at home are dealing with lots of different wellness issues. So today we're going to uncover one. And we're so excited for you to tell us. So what happened, Martita, that wound you up in Dr. Iyer's care?
So what happened was I was feeling headaches, and I came to work one day. The next day, my headache was really tough. I told my husband I could not go to work today, and I went to the ER, and I was transferred. I forgot the name of the hospital. I was transferred to JFK, and that's when I met Dr.
Well, you don't
Iyer.
live in the area. I mean, you're a little bit of a distance. You're 20 minutes away. So you initially went to that ER, and then they transferred you over to JFK. Do you know why that hospital said, you know what, you can't stay here? What was the diagnosis at that point?
The MRI showed that I had blood on the brain, and I needed an operation quickly.
Wow.
Yes.
So that was, I remember getting that call, that was your diagnosis, and the prayer started immediately. I mean, you hear bleeding on the brain, like this is not something that we wanted to hear after our long relationship with you, which is going on. How many years have you worked for us?
Over 25.
Over 25. You left for a bit and came back, but
Yeah.
we are so thrilled to have our relationship with you, but that was
you.
a scary phone call. So you get over to JFK, and then you meet this beautiful, wonderful doctor.
Yes.
So tell us a little bit more from your experience, and then we're going to talk to Dr. Iyer about what she does.
What I remember was I was told that they needed to go in and take the blood out, and they explained to me. I can remember what happened, but I woke up. The doctor spoke to me, and after that, I was feeling fantastic.
Unbelievable. Well, you are a little miracle, aren't you?
Yes, well, the doctor was the miracle.
Yeah.
So, doctor, tell us what type of medicine you practice so that the home viewers can understand why this is your passion. Why did you go to school for this? What is it that makes you want to perform this kind of surgery?
So I specialize in neurosurgery. So that's basically the whole nervous system, the brain and the spine, and that's what our training is, and that encompasses everything from emergencies, like the kind that Martita had with blood on the brain, to tumors, to abnormalities with blood vessels, and even when it comes to the spine, just normal wear and tear changes that can cause a lot of back pain or neck pain, and we sort of deal with the whole range of those.
Unbelievable. So you're an actual neurosurgeon.
Mm-hmm.
And you wound up at JFK how? So close to us. We're so fortunate.
Honestly, I'm from California. I'm a California girl, but I did my training out here on the East Coast in New York. I got married and moved here, and this was my community that I adopted. And JFK turned out to be the perfect mix of a lot of things that I was looking for. It was a community hospital, and it gives you the great opportunity to see a lot of friends and neighbors and family members, and be able to treat them and help them. But it also, after having trained at some amazing institutions in different parts of the country, it has neurosurgical care and very specialized care that rivals or is better than a lot of the best places I've been to. So I felt like it was the best of all worlds.
Well, that is unbelievable news for us all to hear, being so close to this area. I mean, you always think, okay, if I need a major surgery, I'm going to be heading into New York. But no, I think we can come right to Edison.
Absolutely. Yep.
So you have a neurosurgery center over at JFK. So tell me a little bit about that. Like, what surgeries take place? How is that like part of the hospital there?
Sure. So we're well integrated into the hospital. The Neuroscience Institute itself is very unique compared to a lot of hospitals because it has a lot of different specialists, and we all work in the same hallway under the same roof. So it's very integrated collaborative care. So you have the neurologists who sort of see and diagnose things and treat conditions with medications as they can. And in conditions where that's not appropriate or the medications don't work, then the surgeons are right there to sort of take over and say, you know, you need this kind of surgery on your blood vessels. We can do it this way through a big open surgery. We can do it minimally invasively. And then the same thing for the spine. So we sort of have the whole range of subspecialists to be able to treat the condition accordingly.
Unbelievable. And the surgery takes place in the Neuroscience Center or in the main hospital?
In the main hospital, but the Neuroscience Institute is in the same building. It's just off to a different floor. But so it's very easy for us to see patients in the neuroscience area and then run up to the 4th floor and do the surgeries and come back down as we're needed. So.
Oh, wow. So if you don't mind sharing with us, like from your perspective, Martita comes in. How was this? Did they already have the diagnosis there for you to see what you needed to do, or did you have to do some necessary testing and then go in and tell us what you needed to do?
A little bit of both. So they had called from the other hospital that she was originally at, and they said, you know, we did this scan of her brain and we're seeing a little bit of blood. And I was able to take a look at it, and the amount of blood that was there was concerning. So we had her transferred over, and part of the reason we had her transferred over is because we also have an intensive care unit that's dedicated to neuroscience issues. So the critical medical care can also be very specialized for patients like Martita. So that's why we brought her over. And when she first came in, she actually looked great. She looked better than her CAT scan, I have to say. But she was definitely showing signs over the subsequent hours of some symptoms from the pressure that the blood was putting on her brain. So just the headaches and then getting a little sleepier and a little more confused. And that's usually a sign that that pressure is a little too much. And so we rushed her to the operating room.
And when you get into that operating room, what is it that you do? In layman's terms, you just were able to drain?
Yeah, we basically, we try first, if we think it'll be possible based on the scan that we get ahead of time, to just make a couple small incisions, a couple holes that we drill through the skull so that we can see the blood and hopefully suction it out. And that's what we were able to do for her.
Unbelievable.
So,
how long would a surgery like that take?
about an hour.
Which is pretty cool.
Yeah.
Unbelievable. So look at you. And then after she had the surgery, she pretty much recuperated pretty well.
Yes. Very well, in
she
fact.
didn't need to, you know, we were worried, like, did she have to change her diet? Did she? And what is the difference? That was the next thing I wanted to ask you, between what Martita had and a stroke.
So a stroke is usually something that actually affects the brain, inside the brain. Her blood was not inside the brain, it was between the brain and the skull and just putting pressure on the brain. So that actually makes it a little easier as long as we can get that pressure off the brain quickly enough.
Okay.
Then the brain usually recovers pretty well.
Okay, so this couldn't have really been controlled by her diet or exercise or stress or anything like that. There's really no rhyme or reason for it.
Yeah, there's a few risk factors. Definitely if you hit your head, if you're on blood thinner medications, but sometimes you just don't know. So.
Okay. And would you say that the majority of your clients, like, what do they have? Is it similar to Martita's case, or was she kind of special?
Well, she's definitely very
She
special.
definitely is special, I know that.
But it depends. So I would say it's very similar to what a lot of patients who come in emergently present with. And then the people who I see more in the clinic and the office who don't have emergencies, they're usually more the wear and tear changes, the back pain, the neck pain, that kind of thing. So.
Okay. And you follow up with your clients for how long do you usually do that? Like, it's not like you're the general physician anymore, or are you still the surgeon just following up?
I'll still follow patients I operate on for a fair amount of time. It depends on how their scans look over time. Hers look very good, so I probably followed you for about 6 months or so.
Yes.
But she looked great. All she wanted to do was get back to exercising, and I'm like, you're healthier than I am. So
that is so wonderful. Really, really wonderful. Well, we're going to take a short break, and then we'll come back and chat some more.
Mom was always very self-sufficient, but we started noticing things were off.
I was forgetting my responsibilities at work.
I told Mom we should visit a doctor.
Alzheimer's. It was hard to hear that.
Early detection gave us time to seek information and support as a family. I've never felt more connected with Mom.
If you or your family are noticing changes, it could be Alzheimer's. Talk about seeing a doctor together.
We're back. So Martita, after surgery, what was your recuperation like? What was your initial, like, once you, did you stay at the hospital for a length of time?
I was in the hospital for about 7 days.
Okay.
And then I came home. I couldn't lift. I was not able to do too many of my home chores. Had concerns about my looks. Couldn't get my hair color.
So you had a few little areas there with
incisions.
Incisions.
Yes. So I had to wait to get my hair done, which concerned me. Couldn't lift. And I was a little tired when I got home. I slept a little too much for me.
Okay.
Because I'm never tired.
Doctor, why would you say she had that exhaustion, or is that just her body healing?
Yeah, I think part of it is just her body and her brain recovering from what it had been through, and then being in the hospital is also an exhausting experience. You get blood drawn every few hours, people coming in to check on you, you don't get good sleep, everything's kind of off its normal rhythm, so.
Sure, and emotionally. I mean, you're in the hospital for 7 days,
Right.
so, you know, it's, I think she's a real, knowing Martita, like, she just wants to keep going.
Mm-hmm.
And sometimes I think your body just needs that time to rest from trauma. I mean, it was trauma. It's traumatic surgery. It's a traumatic event. Like, you didn't ask for this, you didn't expect this. It basically came out of nowhere. So you get this headache. So the question is, like, what would someone with a headache, what would make them say, wait a minute, this isn't a normal headache?
Pretty much exactly that. We all get headaches. We all get them due to stress, activity level, etc. But if it's something severe, unlike anything you've had before, if it doesn't respond to the normal Tylenol or Advil that you usually have, it's probably worth getting checked out.
Okay. And Martita, would you say that you took I know you were at work the night before and you had a headache.
Yes.
And did you take Advil or anything of that nature?
I took Advil when I got home, but the headache was persistent. So I knew right away that I needed to see a doctor right away.
And the next morning you woke up and you said, that's it, I'm not going to work.
The next day I woke up, I got ready to come to work, but the headache, I couldn't deal with it. It was too much. So I told my husband, we need to go to the hospital.
And it was nothing like a normal headache that you'd had before?
Nothing like a normal headache, no.
Was it on the side where you had the issue, or it was all over?
It was all over.
Okay. And would that be normal, doctor, too, right? Like, I guess it's just all over because it feels that pressure where...
Right. Some people say it's just on the side, but some people have it all over. And definitely if it's associated with other symptoms that aren't normal for you, like nausea or, being more fatigued or not as alert as usual, anything like that can be also a sign to trigger medical attention.
Okay. So then you were home and you recuperated for a while. You didn't have to change your diet or anything, right?
No, I didn't have to change my diet.
So it was really just the physical restrictions that you had placed on her, doctor. Is there anything we're missing by way of her recuperation that you think we need to highlight?
No, I think it was pretty typical and expected. I mean, we just want time to heal up. So, walks around the neighborhood, great, but nothing too strenuous for usually the first few weeks or month after surgery.
And how about your incisions? Tell us a little bit about those. Like, how did that heal? I remember looking at them early on. They had some scabbing. How did you care for all of that? Did you were able to wash your hair, or did you have to put special ointment on that?
Just baby shampoo. That's what the hospital recommended that I use.
And of course, that's not a professional salon product. To all my viewers at home, just kidding. I had to put in a little Vito Mazza joke there. We think you should buy all your products from Vito Mazza Salon. And Martita usually does, until she recuperated from the surgery. So no ointments, no. And was it like stitches, or was it like staples? What was in there?
Do you remember?
No.
We usually put in dissolvable stitches. So,
Okay.
yeah, until it's fully healed, we try to say keep it dry, keep it open, no ointments, nothing that can affect the healing.
Okay. And then not too late after, her hair started growing in pretty nicely.
It did.
We were keeping a nice eye on that. And then she was able to cut her hair with this adorable style, which now is helping her come all together, and it's all come back. So just for the viewers to kind of get an idea, how long ago did this surgery take place? Because I even am forgetting. I think it was February.
It was in February.
How did I remember that? Okay, so February of last year. Yeah, this past February.
This past February, yes.
Wow. Unbelievable. And look, you're all good. And now you're a grandmom again,
Yes, I am.
which is so exciting. So she's had so much to look forward to in the last few months, holding that beautiful baby.
Yes,
And, you're all back together.
I think so.
So we're so happy about that.
Thank you. Thank you.
So, doctor, explain to me a little bit more about the Neuroscience Center and the types of clients that would be facilitated to there, because I want our viewers at home to get a sense of, who could go there for care in the upcoming, years, months, and local area.
Sure. Again, it's very broad, really anything brain or spine. We have a subspecialist who is well versed in treating that condition. So it could be anything from, I have a pinched nerve in my back and I have leg pain or arm pain. It's I'm having trouble walking, and we have everything from pain management physicians who specialize in the spine, who can do, very tailored, minimally invasive procedures. And then we have surgeons who can do everything from the minimally invasive to the huge, whole body fusions, if that's what it called for. With respect to the brain, again, anything from movement disorders, from something like Parkinson's disease to dementia, and more on the surgical end, anything from an aneurysm, which, could cause bleeding in the brain, tumors, of course, the traumas that we deal with. So we really have specialists for all of it.
So when you were in medical school, how did you get to this road of neurosurgery? What made you feel passionate about wanting to do this?
I think I've wanted to be a neurosurgeon since I was 3 years old. So my dad was an engineer, and he'd run around the house fixing everything that broke. And I was like, I want to be able to do that for the brain. That's what makes people who they are. And if I could fix that, so that was, as long as I can remember, that's been pretty much my focus. So.
Wow, and you had your family's support in that, I'm sure.
Absolutely, yes.
And what is your schedule like? What is the day in the life of doctor?
On most days, fairly predictable, seeing patients in the office, 8 to 5. I have dedicated days to be in the operating room. And then, of course, there's the days I'm on call, and that's very unpredictable. So that's when the emergencies can roll in at any time of the day or night.
So you were on call, and thank God you heard the call.
Thank God.
So that is really, really great. Thank you for giving us your time today and being here with us, because it's certainly a sacrifice to ask you to do that. But what a great blessing to this community to be able to see you face to face and know that they can come see you if, God forbid, there was ever an emergency, in this local area. And I'm sure that, you can facilitate to many, many people's needs. So we're certainly grateful that you came today.
Oh, thank you. Thank you for having me.
And Martita, you too. I know you got out of work just a little bit early today. But I thank you for all that you do, and thank you for sharing your story to the Woodbridge community as well, because, it's so nice to hear a personal story from something someone's been through, and be able to just see that there is life after that, and recovery, and with great care, and knowing that that great care happens so local. So we're really grateful.
Thank you for having me.
Yes, Thanks for coming. And thank all of you for coming today and joining us at Wellness Woodbridge. We love having this time with you, and we hope to do more and more shows in the future. But until then, have a great, wonderful season, and we'll be back soon.